Welcome back to Medicine Made Easy with me, Kavithandran. Now we are going to discuss a very important topic in retina in ophthalmology, and that is retinopathy of prematurity, which is in short called as ROP. Before we actually proceed with topic, if you have not subscribed to our channel, do subscribe for more interesting videos like this, and as well press the bell icon so that you will receive regular video updates. And also, you can share this video to your friends so that we will all learn together. In this video, I've made the entire process. This is process of retinopathy of prematurity, and in the next video, part 2, we will be discussing about the treatment and the screening protocols. Without further delay, let us start our discussion. Before and all, this retinopathy of prematurity is called as retrodental fibroplasia. Let us first take from the name. What do we infer from that? Retro is something posterior, lentil is something related to lens, something posterior to lens. This pathology is happening. Fibroplasia, that is fibrovascular tissue. Plasia means hyperplasia, no, increased number of cells. So there is proliferation. Now, retinopathy of prematurity. Retinopathy does says this posterior to lens is area localized now to retina. Pathy says the pathological process is not inflammatory. No, it is not unlike it is not involving the neutrophil or lymphocyte and so on. And the pathology is in the prematurity. Prematurity. It means what? This is going to happen in babies. Yes, it is a pediatric pathology. Whenever the baby is born and it is premature. How premature? It is less than 1500 gram on birth weight, that is LBW, low birth weight baby. Next, less than 32 weeks of gestation age if the baby is born, then that is what is called as prematurity. So this is a pathology we are going to deal in the pediatric age group, especially in the neonates. Okay, so what are the other causes? It is whenever the baby is in oxygen supplementation therapy or birth asphyxia, respiratory distress syndrome, acidosis, shock, vitamin E deficiency, or some other causes. How at all this retina and prematurity is related? Yes, it is related to the embryology. So by the 8th month, the vessels reach the nasal ora. That means the vasculature of retina in the nasal ora. Ora means ora serrata. Ora serrata is the most peripheral part of the retina. So the peripheral part of the retina is going to reach the blood in the nasal side by 8 months, whereas the temporal side is going to receive by 1 month after birth. Right? So this is normal. So what happens if there is premature birth, prematurity? This process is not properly done. That means it is halted. Because of this, there is the pathology happening. That what is that pathology is because the prematurity, immature vessels are prone to damage in presence of oxygen, because many a times a baby which is born premature needs oxygen support. So at this time, this immature vessel is going to cause vasoconstriction changes. Okay, this vasoconstriction change is the phase 1. Because of vasoconstriction, what happens? There is a, yes, blood supply decrease to the retina. That in turn, the retinal tissue is going to release excess VEGF. This VEGF, and this is going to cause neovascularization. This neovascularization will in turn cause proliferation, and this proliferation, thus fibrovascular proliferation, that in turn cause that is fibrous band is going to form. The fibrous band is going to contract. That is going to cause the what? Detachment. Yes, by contraction of contraction band, it causes a retractional detachment of retina. That's all it is. This is the pathogenesis. Now we need to know the clinical presentation. Majority of time, baby is going to present with leukocoria, that is pupillary white reflex in the pupil, or the differential diagnosis is leukocoria. We have done. Next is familial exudative vitreoretinopathy, persistent fetal vasculature, or incontinentia pigmenti. Remember, just we'll remember like this. First is fever. Remember FEVR, like fever. R for ROP, O for leukocoria, P for persistent fetal vasculature, then IA, that is incontinentia pigmenti. Just to remember. These are all the differential diagnosis. But majority of time, baby is going to present with leukocoria. The differential diagnosis of leukocoria we have discussed in the previous video on retinoblastoma. If you have not watched the video, I've given the video link in the description. Please check it out. Now we are continuing with the classification of retinopathy. This is very, very important. Without understanding this classification, we cannot go understand the concept behind the retinopathy of prematurity. Okay. See, the international classification of ROP has given stage, zone, and extent. Right. Okay. Let us see one in detail. First, we'll see the zones. See, this is the retina. In this retina, usually this is a retinal chart. No, we make a retinal chart to find where is the retinopathy of prematurity happening. Okay, right. So this is the center, zone 1, and it is zone 2. This is zone 3. How do we divide this? Is, remember, usually we take which part of the retina center? Yes, fovea. But here we are taking the optic nerve, that is optic disc, no? Optic nerve head, no? Optic disc. We are taking this as center point. Having taken this as center point, from here to macula, that means the fovea, no? So the fovea to the optic disc is one radius. 2 times of this will be the zone 1. Okay, 2 times of this radius will be the zone 1 diameter. Then zone 2 is from the optic disc to the nasal ora. This is the zone 2, this round. Then whatever the temporal arc which is left beyond the zone 2 radius, then that is called as zone 3. Remember this, zone 1, zone 2, zone 3. Why it is important to remember is any pathology, that is any pathological changes which is happening in the zone 1, it is called as severe ROP. Now this is important. Now next, coming to the stages. Stages is very simple. See, I said no, there will be a demarcation line. That means in retinopathy of premature there is a avascular retina and vascular retina. This is marked by a line that is called demarcation line. This is stage 1. This line will thicken. This thickening line will then be having proliferation. This proliferation has fibrous band. The fibrous band will contract, will cause retinal detachment. Okay, this is the sequence. If there is only demarcation line, we see avascular retina and vascular retina. I said right, the avascular retina, because of the hypoxia, is going to release VEGF. Yes, this VEGF is going to cause this vascular retina, the vessels in the vascular retina, to proliferate. Okay, that is what is happening. That initially demarcation line will form ridge. Over the ridge, because of the excess VEGF, this vessel will proliferate. This is not a simple vessel proliferation. It is the fibrovascular proliferation. No, ridge with extraretinal fibrovascular proliferation is also happening. This fibrovascular proliferation will result in subtotal retinal detachment. This subtotal retinal detachment initially will not involve the fovea, that is called extrafoveal. Later it will involve fovea, that is called as detachment including fovea. At last it will cause us total retinal detachment. Okay, so line, demarcation line, ridge, fibrovascular proliferation, and RD. The same, no? In the diagram we see, right? Initial stage 1 demarcation line, stage 2 ridge, stage 3 fibrovascular proliferation, and stage 4 retinal detachment, and stage 5 is total retinal detachment. Now we will discuss about extent of ROP. Remember, I am mnemonic with TRP. Okay, T for threshold, R for rush disease, P for plus disease. Okay, retinopathy of prematurity is a pathology. It manifests as these things in the retina. Okay. So you remember there is something called plus disease, rush disease, and threshold disease. Let us now discuss in detail like this. Okay. So let us make tabulation to make easier understanding. See, plus another in the disease la what changes happening, what stage and what zone. That's all. Okay. Let's make it simple. Plus disease means if at all we see dilatation and tortuosity in the posterior pole vessel in 2 quadrants. This is very important. Plus disease is dilatation with tortuosity of posterior pole vessel in 2 quadrants. So remember P for P. The moment you say someone is saying plus na, plus disease means that means progression of ROP. This can be any stage. Now coming to rush disease. Rush, no, it is rushing, like the flat. It is basically a flat proliferation of what we see in vessels. Yes, the vascular loops will be proliferating. That will be associated hemorrhage also. This is called rush disease. This rush disease also can be in any stage, but this disease, no, it is a rush disease. No, it is very severe. Severe means what we have studied. Yes, zone 1. If it is a zone 1 disease involving flat proliferation, vascular loop, and hemorrhage, or it can be zone 2 with severe plus disease. Plus disease means what? Dilatation and tortuosity in the posterior vessels in 2 quadrants. This will happen in zone 2 area. Then that is called as rush disease. Rush disease needs immediate treatment. Next is threshold disease. Threshold disease means 3 plus stage of ROP. Okay, what is the 3 plus stage? Yes, line, ridge, and fibrovascular proliferation. It means fibrovascular proliferation with plus disease. Plus disease is dilatation, tortuosity, and which is seen in the 2 quadrants of the retina, posterior pole. This is happening in zone 1 or zone 2. No, zone 1 means immediate, no, severe disease. Yes, so it is happening zone 1 and zone 2, but it is 5 continuous clock hours or 8 discontinuous clock hours. It is happening only. Then it is called a threshold disease. That means 3 plus ROP with plus disease happening in zone 1 for 5 continuous hours or 8 discontinuous hours, clock hours in the retina. posterior pole of retina, then it is called as threshold disease. Remember, threshold disease T is like 7, no? So we need to treat the disease less than 72 hours with laser therapy. Okay, this is very, very important. Now we come in, there's an entity called pre plus disease. Pre plus disease is what? Pre means before. Plus disease, that is, if there is venous dilatation and arterial tortuosity, which is more than normal but less than to be defined as plus disease. So we should be knowing what is a plus disease. Again, remember, venous dilatation or dilatation with tortuosity of posterior pole vessel of 2 quadrants. This is called as plus disease. If the 2 quadrants is not satisfied, but there is venous dilatation with arterial tortuosity, then it is called as pre plus disease. Next, move on to pre-threshold disease. Pre-threshold disease is classified by early treatment of ROP, that is ET-ROP, into two types. One is high risk and low risk. High risk is we need to do laser therapy, laser photocoagulation as treatment, and low risk we need to do follow-up. What is high risk? We know high risk na for it should be a severe disease. Severe disease means it is involving zone 1. Okay, and plus disease involving plus disease says progression. If at all, a plus disease of any stage in zone 1 or non-plus disease of stage 3. Stage 3 is, yes, a plus disease of stage 3 is zone 1, it's a high risk. Or zone 2 with stage 2 or 3 plus disease is also called as high risk. Okay, this is important. So pre-threshold disease now it is two type, high risk and low risk. In high risk, zone 1 plus disease, zone 1 non plus stage 3, zone 2 stage 2 and 3 plus disease. This is all about the pre-threshold. Now we are going to end the video. Before that, I'm going to give you a simple task. So you see this image. This image you are going to say me. What are we seeing here? I put the arrow marks. No, see here. This is the nasal. This is the optic disc. So this should be the zone 1, right? Okay. So see here. This is the nasal side of retina. This is the temporal side of retina. See here. There is no vessel. This is avascular retina. This is the vascular retina. Now what are we observing? There is tortuous artery, and this is the dilated vein. Vein will be always large and dark, no? In fundus, yes. That is dilated vein, which is here, and tortuous artery. This is one quadrant, no? And as well here, no? This is another quadrant, no? This is tortuous artery, and this is dilated vein. You see here. So what is this? We can also see in the nasal side also, right? The same. Inferior nasal quadrant, no? Dilated vein and tortuous artery. What is this? Any guess? Yes, this is the plus disease. No, what is plus disease? There is progression, and it is arterial tortuosity and venous dilatation of more than two quadrants or more. That's what it is. So with this, we are ending this video. And next video, we will discuss about the management of ROP and so on. Till then, stay tuned. Bye bye.